Hi, my name's Ian Battersby. I'm Head of Internal Medicine at Davies Veterinary Specialists, and today we're at the Davies Fitness and Therapy Centre, which is on the same site, and I'm joined by Diane, Head of our Physiotherapy department, and today we're going to talk about rehabilitation of dogs and cats with neuromuscular, orthopedic and spinal disorders, and Diane's going to give an overview. So Diane, it's a new kind of expanding field, or the rehabilitation in these areas. Can you just give us an overview first of all?
So I suppose rehabilitation can encompass a number of things, and we mainly focus on physiotherapy and hydrotherapy here at the Therapy and Fitness Centre. And we also have a pain management clinic as well, which will involve the physiotherapists working alongside the team of anaesthesia that we have here. So aside from that, the physiotherapy aspects will cover a number of areas also, which includes prehabilitation, which is a new evolving area. There's a lot more focus on that. We also look at early detection of injuries, so working alongside our working dogs or our athletes and trying to detect early problems and preventing and being more proactive in preventing them evolving into something more significant. We therefore also work alongside our orthopaedic and neurological teams here to see our post-operative cases, and the earlier we can intervene with those, it improves their functional outcomes, and we'll expand. I can expand on that. And also then finally, before we move on, is talking about end-stage scenarios. So we also work alongside, as I mentioned, the anaesthesia team, and we look at how we can help pets with osteoarthritic changes, deteriorating functional capabilities, and working alongside them and their owners in how to optimise their well-being at home and improve their quality of care.
Okay, so it sounds like, I mean, there's a huge amount of people, you know, and input into these cases, because you've got the pain aspect, you've got the physiotherapy aspect, you've got the hydrotherapy, and all kind of getting a global overview of these cases. And you use some nice kind of headings there that we can expand on. So there was prehabilitation, post-operative, early detection of injuries, and then end stage. So I have to admit, prehabilitation, that's a term I'm not really familiar with. Are you all right to just expand on that and overview how you assess the patients?
So it's something that we've done, has been around now in the human field for a number of years. But it's looking at bringing our patients in before they have major surgery and looking at their lifestyle at home, trying to make changes in preparation for their post-operative recovery. We look at their overall fitness and looking at their giving them exercises which prior to surgery, which will help improve and speed up their recovery post-surgery. So improving their functional capabilities after surgery. It's also, I suppose in our case, we're also educating the owner on what pain their pets might experience post-surgery as well, and raising their expectations, or sort of improving their expectations so they know how to prepare themselves and what they might see following surgery. And also it's looking at nutritional aspects as well, so not only the physio and exercise components, but looking at the nutrition and what they can do to help optimise their recovery.
So it's kind of like getting, for an elective procedure, I presume.
Yes, more so.
Yeah, it's getting everything as optimal and fit as you can, so that hopefully your post-op will be as short as possible.
Yes. And yes, and their pets, if they need a crate or if they need to improve their flooring at home, they can address all those issues prior to their pet going home, and they're not rushing around once they get their pet home trying to put these things together. Okay,
cool. So then you talked about early detection of injuries. So are you able to expand a little bit more on that?
So we have a large number of athletes and working dogs in this country, and I think the forces and demands placed on their body can result in changes occurring that can be picked up quite early, that then to prevent them from moving into a more significant problem, we can advise the owner on how to manage them and look at being more proactive in managing early detection of these signs with regular warm-ups, making sure they're warming up prior to their competitions, looking at stretches, static and dynamic stretches, at home and then on the competition field for these agility patients. And then treating anything else with manual therapies or any other exercise therapies that can be involved in trying to prevent these problems from becoming a bigger issue and preventing their dog from doing
Developing.
their normal everyday life.
So kind of that's more, I suppose, prevention of something more, like a big op being required by putting early interventions in again. And
Yes.
so that would be, you mentioned agility dogs. I mean, if I remember correctly, you've also been doing some work with kind of working dogs as well, is that right?
Yes, so we've been looking at certainly the police force and how their working dogs are working every day and what demands are placed on their body, and looking at advising them on what they can do differently or things to watch out for, particularly with the suspected use of harnesses in the future, and also everyday harnesses that are being used currently as well. So it can be going right back to those sorts of things that we can help advise.
So there's a huge scope of dogs that could potentially benefit from that then?
Yes,
that kind of assessment?
Yeah.
Huge. Okay.
Absolutely.
Cool. So moving on to post-operative assessments and plans and things like that, could you overview your role and the team's role in that?
So we're very fortunate here to work alongside a fantastic team of orthopaedic and neurological specialists, and which we probably mainly work with on site, although we do cross paths with the other disciplines. But I guess the most important thing that we can do for these post-op cases is early intervention, and we can monitor their pain levels, because not only, I think there's a misconception that physiotherapy involves a lot of either massage or high load exercise. And so quite often we get a lot of people saying, oh, don't do too much with this dog, and I'm not sure what they think that we might do with these post-operative cases, but certainly we look at their pain levels, and we can talk to the nurses and give them our opinion, because we're very good with our hands. We can detect, when there's pain present. We do a full, palpation when we assess them initially, and very carefully, and so we can advise, the nurses and the veterinary surgeon in charge, what our opinion is on their level of pain. So we're looking at that aspect, and then we're looking at early low-level manual therapy interventions, and that can, for our neurological cases, include sensory stimulation, maintaining passive range of motion of joints that, for those recumbent patients that aren't doing a lot these days, a lot at the moment, because they're having just received surgery. And then for those that are higher level, we can start implementing very basic low impact strengthening exercises, and that can be as basic as stripping it right back to their core and doing standing practice, and then challenging their balance a little further by knocking them off balance. And for me, it seems like a very simple exercise for a lot of people, but for me that is the foundation for everything that we will then build on. So there's a lot we can do.
So for me, I mean, I suppose thinking about it, just to clarify as well, there's almost like two phases that I guess people might not appreciate. There's the immediate post-op when you're liaising with the nurses in the wards when patients come out of theatre. So I guess people might not be as obvious that you're assessing patients at that very early stage. And then when they've gone home, there's still the kind of maintenance post-op period where they come back for assessments and things like that. Okay,
absolutely. Cool. So working on that basis, we see them as an inpatient on a daily basis, and then particularly with our neurological cases, we will see the owners at the point of discharge, and we can then advise them on their discharge management and exercises that they can continue at home to help enhance their pet's progress. And I think the most important thing is being able to see these cases quickly after surgery, so it helps enhance the healing process. It speeds up the healing process. It enhances their recovery of mobility and function as well. So it'll speed up that process. And as I said earlier, it's sort of minimising pain. And also I should mention that it's minimising post-operative complications as well, because not only are we looking at the musculoskeletal system, but we can also have involvement in managing the respiratory system and making sure they don't get any post-operative complications from being recumbent for long periods of time, and they're developing respiratory issues that we can help manage and prevent.
Cool. So I guess moving on to the last category you mentioned, which was end-stage patients. So I mean, if you want to overview again, I presume there's a lot of input from different people in that area.
This is probably more a multidisciplinary approach, and this is where we work very closely with the whole team here at the Therapy and Fitness Centre. We work alongside our team of anaesthesia specialists and the hydrotherapists. So what we're mainly doing, we're working mainly with those cases that have significant osteoarthritic changes, and working with the owners on lifestyle management, pain management aspects, exercise management, and again, nutrition can fall into that heading as well. And we're looking at maintaining comfort, mobility and function, and optimising their overall well-being and quality of life. And I think working closely with the family in those circumstances as well is quite important, because I think it's very hard for a pet owner to know when it's the right time to say goodbye. And whilst we're not there to say that, we can use measures. We use an objective measure here in our centre, which helps us get a trend on how that pet's doing with interventions of different treatments, and then we can detect whether there is we're getting deteriorating function that the owners then can visualise, and it helps them make a decision ultimately.
So I guess, from an objective point of view, rather than just making a look at the dog and think, oh, I think it's better than yesterday, you're actually measuring certain factors that you can then document and look at the trends, which I guess is a bit more visual and easy to understand.
Yes, and it's the owners feel this objective measure at home. It's a questionnaire style measure that the questions are focused on their pet at home and around home, and how they're doing on a day-to-day basis. So it's been validated. It's a great addition to what we deliver here and help with these types of patients essentially.
Okay. So I mean, just out of interest, say if a patient was referred to the Endstage clinic, because you've got a lot of different things that you've mentioned. You mentioned your team. We've got the anaesthesia, pain assessment, and then we've got the hydrotherapy. Can you maybe just, I mean, you can't go into detail, but maybe just an overview of the timeline? Like, would there be an initial consultation with one person and then another, or is it all together?
So the initial consultation for these pain management cases is an hour and a half, of which it will involve discussion with myself or Sarah, my colleague, physiotherapy colleague, and one of the members of the anaesthesia team. And we will ask the owners a series of questions to glean what we need from their home lifestyle and how their pet's doing on a day-to-day basis. We then do a general wellbeing assessment and health check. So that will be where the anaesthetists will be involved. And then we will assess gait. We will look at their general function, their ability to transfer with ease, and then I'll do or my colleague will do a full musculoskeletal assessment from head to tail to detect where problems lie. We'll come up with our problem list. We'll then have our goals, and then we'll come up with a treatment plan.
Okay.
And that could include the physiotherapy leading that pet's treatment, the anaesthesia team, and potentially acupuncture leading the treatment, or hydrotherapy also coming into that scenario. And in a few cases, all three of us will have some input into their pet's care. We've got a number of cases at the moment where they come and have their acupuncture prior to going into the underwater treadmill, because it helps alleviate pain, and therefore their function and ability within the underwater treadmill environment is greater and optimised. So yes.
So thank you very much, Diane, for answering all those questions. And I'm sure if people have got questions, they can post them on our Facebook or social media sites, and we can get back to them.
Okay, thank you.